Please bend your knees and put your hand somewhere where you can feel your pelvis. It's called the iliac crest, the two sides of the pelvis that are very close to the surface of your skin, kind of easy to feel. And now slowly draw your abdomen in and push your abdomen out, just slowly. So you draw your abdomen in and you push your abdomen out, and see if you can feel that each time you do that, your pelvis moves a little bit. Okay? It's not just your abdomen, but that when you push your abdomen out, your pelvis tilts a little bit away from your head. And then when you draw your abdomen in, your pelvis tilts a little bit toward your head. And when you push your abdomen out, your lower back actually tilts a little bit away from the floor. And then when you draw your lower abdomen in, your lower back comes a little closer to the floor. Just see if you can feel that little tilting movement of your pelvis. Okay? That's all. The pelvis tilts as a result of that movement of your abdomen that you don't do every time you inhale and exhale. You can do it 2 or 3 times and then you rest. So or you can do it once and rest. And you just keep feeling where you can reduce the effort, where you can, inside yourself, you can do less. Obviously, you need the effort to push the abdomen out and draw the abdomen in. Of course, that takes mobilizing yourself in a particular way. But within the context of doing that, see if you can reduce the effort. And just pay attention to that little movement of the pelvis that you feel each time you draw your abdomen in and push your abdomen out. Now, you can feel that if your pelvis is tilting a little bit down or away from your head, and then a little bit toward your head, just you feel how far up your spine do you feel that movement? That movement of obviously the vertebra of your lower back move, don't they? The vertebra tilt a little bit away from the floor when you exhale, and then they tilt a little bit toward the floor when you inhale. It's not that you do something with your pelvis, but how far up your back, up your spine, do you feel a resonant movement, a resonating movement of your spine? In other words, it's not something that's only happening in your lower back, but maybe you feel it a little higher. All right, and stop and rest for a moment. Bend your knees. And now let your knees fall. Let the right knee fall to the right, left knee fall to the left, and then bring the soles of your feet together. That's it. Put your hands on your pelvis again. And continue with that idea of drawing your abdomen in as you inhale and pushing your lower abdomen out as if you could open your sphincters. And feel if that movement of your pelvis has become a little clearer because of having the soles of your feet together. That tilting toward your head and then away from your head. Inhaling, drawing your abdomen in. Exhaling, pushing your abdomen out. And that's right. And you can feel your knees move a little bit. Not that you move your knees intentionally. Now, Danielle, try one less behind your head. Try. Mm-hmm. Okay, rest for a moment. Moving gracefully, easily, comfortably, in a way that's congruent with our structure, that's congruent with our intention, doesn't necessitate the big cortex that we have. And so that the more movement is something kind of intentionally or self-consciously regulated, the less room we have for thinking, feeling, sensing, creating, the kinds of things that the size of cortex that we have is incredibly unusual. We're the only one with that much, what would you call, undedicated space. And it's that undedicated space that enables us and allows us to think and create, to sense ourselves, to choose. Bend your knees and put your hands on your pelvis again. Your feet are spread about shoulder width apart. And now see if you can tilt your pelvis a little bit away and a little bit towards your head, but independently of your breathing, so that you don't push your lower abdomen out, but you just breathe easily, and once or twice you tilt your pelvis a little bit down and a little bit up, and then you rest for a moment, and then you do it again. So it's not that you hold your breath, and it's not that you push your abdomen out and pull it in. You just breathe easily and comfortably. Of course, you might find that breathing one way or the other seems more comfortable to you. But you see if you can move your pelvis more or less in that way, independently of your breathing. Just slowly. You don't lift your pelvis or your tailbone off the floor. Of course, when you tilt your pelvis toward your head, you may feel that the heels of your feet press against the floor a little bit. Just slowly. And now notice how far up your spine do you feel the resonance of that tilting of your pelvis. As I said, don't do it in a repetitive, constant way, but just simply. Where does it stop? Or where does your feeling of that resonance stop? Somewhere in the middle of your back, your upper back. You just follow it. Don't try to change anything, correct anything. Don't try to make it better or stronger. All right, and rest again. Again, just observe the relationship of your back to the floor, your shoulder blades, the movement of your lower abdomen as you inhale and exhale. Bend your knees and bring the soles of your feet together. And again, if you find this position uncomfortable, then of course you don't do it. You just stand your feet, or you wave your arms, and one of us will come over and help you. And now, or you just do 2 or 3 movements, and then you stop. Now, with the soles of your feet together, go ahead and your hands on your pelvis. Slowly tilt your pelvis a little bit toward your head and away from your head. A little bit. Again, your soles of your feet are together, not the insides of your feet. So again, you inhale and exhale simply. In other words, you don't hold your breath, but just slowly tilt your pelvis toward your head and away from your head, and toward your head and away from your head. And notice, again, how far up your spine you feel that movement of your spine. And now notice, does anything change in the relationship of the back of your head to the floor? In other words, as you tilt your pelvis away and toward your head, and away and toward your head, See if you feel something change in the contact of the back of your head with the floor. Okay, rest for a moment. Bend your knees, stand your feet, and now just make a very small movement of your head in which you kind of nod your head a very tiny bit up, meaning that that's right, that you tilt your head and your chin comes away from your throat, and then you descend your chin. Right? So slowly. That's right. So a yes or a no. Of course, I know Bulgarians do it the opposite, but it doesn't. It's fine. It's still the same movement of nodding your head a little bit up, and of course you feel that the pressure of the back of your head on the floor changes, and then nodding your head a little bit down. Just small movement. And you lift your chin a little, and that arches the back of your neck, and then you tilt your chin down a little bit, and that straightens the back of your neck, doesn't it? Now, put your hands on your pelvis again, and now notice, what do you feel in your pelvis when you do that nodding movement of your head? Does something happen? If you relax your abdomen deeply, you'll find that each time you nod your head up a little bit, your pelvis tilts a tiny bit toward your head. And each time you nod your head down, your pelvis tilts the tiniest bit away from you. And feel, you nod your head up, and your spine is pulled up. You nod your head down, and your spine gets ever so slightly pushed downwards. You just see if you can feel that. Without holding your breath. Good. Now, go back to moving your pelvis intentionally and see if, not your head, just see if tilting your pelvis away from yourself and away from your head and towards your head, if what? If it connects a little higher up your spine. And if you can feel where's the dampening? Where does that movement stop? Or can you feel when you tilt your pelvis toward your head that your chin nods up a little bit? And when you tilt your pelvis away from your head, your chin is pulled down slightly. It's not big, and it's maybe a smaller movement than that of your pelvis. Right? But it's clear. And the primary thing that you have to do is to not interfere You have to feel where to relax your neck, where to relax your jaw, and you'll see that as you relax your jaw and your throat, the movement of your head begins to be independent of your neck. In other words, that the head's not moving like one piece with your neck, but your chin is tilting up. Here, do it intentionally a few times. Remember I said earlier, if you do the thing intentionally often, just a few times, you find that the nervous system adopts the thing. Why? Because it makes sense. Because it is easier. So now, slowly, when you tilt your pelvis towards your head, lift your chin a tiny bit. And then, when you tilt your pelvis away from your head, bring your chin down a tiny bit. Slowly. Just slowly. Now bring the soles of your feet together, the soles of your feet, and do the same thing a few times. Nodding your head with the movement of the pelvis. So your pelvis tilts up and your chin comes up. And you tilt your pelvis down and you bring your chin down a little. And now just do the movement of the pelvis and do it quickly, like blop, 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 and do you feel that up to the top of your head? Don't do anything intentionally with your head, just your pelvis, blop, 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 blop. Good. And stop and stretch out your legs. And observe your contact with the floor, your shoulder blades, your lower back. And bend your knees one last time, stand your feet, spread your feet shoulder width apart, and just do that very first movement of pushing your abdomen out and drawing your abdomen in, and see how does that compare to when we started. Feel when you push your abdomen down and out, do you feel that in your neck, in the back of your head, on the floor, your chin? Good. And stop and roll to your side and sit and slowly come to standing. And slowly come to standing, and then feel. If you just stand there and just observe, where does your head come to spontaneously? Feel. Is the back of your head more back than usual? Feel something different in your lower back? Feel more hollow or arched in your lower back? And the distance of your chin to your throat and your sternum? Something feel wider in your chest? And see if you can relax your lower abdomen. And notice if you think of inhaling into your lower abdomen, of course you don't really, but if you think of inhaling into your lower abdomen and your lower abdomen going down, just observe. Do Do you feel that you get shorter or taller when you do that? Does your spine elongate upwards or downwards? And walk around for a moment before you think of what you will do next.